This is Sheriff Spotlight with the Rockingham County Sheriff's Office, highlighting the office and deputies dedicated to providing law enforcement services and maintaining the trust and support of Rockingham County citizens, all while keeping neighborhoods and communities safe.
Good morning, I'm Sheriff Sam Page, and we're coming to you for the April Sheriff Spotlight. Today we have a special guest, someone we don't have in the office every day. We have Miss Susan Young. Susan Young, welcome. And Susan is our acting health director at this point, and hope she's going to be our full-time health director because she's been very busy over the past 2 months. 2 months. And you know, we're going to talk about today. We're going to talk a little bit about the coronavirus. And some things that you can do to help protect yourself, protect your family. I have some of the most asked questions here, and it's many, and we'll take our time and go through them. Okay. And like I said, I just appreciate you being here.
Thank you.
And we appreciate what you do. I'll just go ahead and get it out of the way. We appreciate what you do for Rockingham County to help keep us and our family safe and informed about what's going on. And we hope today, when you finish, some of the questions you have will be answered. Okay?
Okay.
So, Susan, I got to ask you this. First of all, how long have you worked for the county?
I have worked for the county since 2004, so going on 16 years. And
did you come from the medical side or career field, health career field?
Yes, I have been a nurse for, I'm going to tell my age, I tell you, almost 30 years.
Wow.
I started off here at a local hospital, did floor nursing, and then went down to surgery. I've done some home health nursing, and then transferred over to the public health side of the world.
So with all the experience that you have, and then of course with the pandemic coming on over the past couple of months, it really helped to prepare you kind of for what we're up against.
Absolutely. The more experience you have in varied medical fields, the better off you can handle different situations. And because this is a new situation that we've not faced before, that is very good experience.
Yeah, I don't want to mix issues, but you know, one of the things I can remember back when I was in service back in the 70s was the swine flu.
Oh yes.
And of course we all had to get the swine flu shot and stuff when we were in service, and again it was a serious time, but you know, we've been following the coronavirus from China since about what, December?
December and early January is when the spotlight really became focused on it.
So again, we'll talk. We'll ask you some questions, and you feel free to chime in and stuff like this. I did bring a couple of things with me, a couple of masks. I do want to say this is your loop mask, and this is probably the standard mask you'll see most people wearing, something like this. But availability.
It is very concerning because these are also the masks if we do not have N95 respirators, and you have to be fit tested to wear the N95 respirators, which are the cone-shaped respirators that fit very closely. The healthcare professionals will wear the loop mask in place of those, so they are, you know, kind of being generally used for the healthcare providers when they don't have that N95 mask to wear. So we would like to keep those as much as possible for the frontline staff and the healthcare workers, first responders, and people like that if we can.
If someone was interested in picking up the standard loop mask, stuff like this, where would be a good starting point?
Well, you can try to order things online, Amazon and different places. In the past, you've been able to order those from there, but of course there seems to be a supply shortage going on, of course, right now with everyone trying to get masks and use masks, and as they become less available, people are going to making their own mask, and they're using that pattern or using different things.
You know, this is a shema and stuff like this, and this is a head wrap, face wrap, and to protect your face, but I didn't have a bandana, but it's kind of like a bandana, but bigger. But you know, I'm not surprised at what I'm seeing out in public as I'm going out and you know, going out to, because you know, I have to go to the grocery store also. I have to go out to different businesses, and plus just riding out in the community. But yeah, I see a lot of different type masks and stuff. But I figured if there was hard to get these items right here, these loop masks, and you couldn't get the N95 mask, which is very sought after in the medical profession.
Absolutely.
That you might see people make. You told me you made your own. Was somebody made it for you?
I had someone at work had their kind of a group there of kids that didn't have a lot to do, and they're people that's going into the medical profession. And our practitioner actually bought it in for a lot of our staff. And they're very cute. They're very kind of personalized to the things that you like. So it was a very nice gesture.
Okay, so somebody may make you a mask, and it's appreciated. But the main thing is you're covering your face. But what I hear is that the really a person that has maybe flu symptoms or coughing, that's really the person needs to wear the mask.
Absolutely.
Or it was originally recommended.
Yes, the person who was sick needed to wear the mask to keep it because it is spread by respiratory droplets. And of course, if you have the mask on, your nose and mouth are covered where the droplets are coming from.
Okay, and so just a little information there, because a lot of people ask, well, how do or where do I find the mask and stuff like this? How about rubber gloves? Of course, I put some on when I go shopping and stuff. I noticed there are certain protocols in the shopping centers, or like I'll drop a name, Food Line, Walmart, stuff like this. They have certain protocols they have to follow, and cleaning the carts. I noticed them to clean the carts really great. But if you did need to seek out some rubber gloves, same thing. Go online, probably.
You can go online, and also auto stores are an amazing place to buy some of these things. You wouldn't obviously think sometimes you can get masks and rubber gloves at like your dropping names, Advance Auto and places like that do carry some of those.
AutoZone, stuff like that.
Yes.
And they're the basic nitrile gloves and stuff like that.
Yes.
Which are protective and stuff.
Yes.
Okay. So we're talking a little bit about protection and stuff like this. I know that some recommendations from the federal side at the White House, and also down to the local level, the governor's office, and then locally, there's some basic recommendations how to protect yourself. And I know that basically you're asked if you don't have to be at certain locations out in public, you need to stay home. Okay. But what are some of the recommendations as far as masks and other things can you do to protect yourself when you're out in public?
You need to stay at least 6 feet away from any other person. That social distancing is the one most important thing that we can do that will prevent the spread. Because if you're 6 feet away from somebody, your chances of getting anything or catching anything go down dramatically. Also, washing your hands, that is basic. If you're out and you go shopping, as soon as you come in, unpack your groceries, you wash your hands. I mean, that hand washing is the one thing that you can do that will prevent.
Yeah, I was watching Ellen's show, and I catch Ellen before I come to work in the morning, because I come in a little bit later and work a little bit later. And I noticed that they had some songs where 20 seconds they recommend.
20 seconds.
Washing your hands, soap them up real good, and wash it. So some people are singing the songs and stuff like that.
Right, and that is very important. If you use tissues or you sneeze, you need to sneeze or cough into your sleeve and catch that, and be sure that you're not spreading those germs, because once again, it's coming out of your mouth and nose, and that's the way it's spread.
Now, I know there's a little bit of medical paranoia, because a lot of times people are trying to social distance. It's so awkward not to shake a hand.
Right.
Because we're generally a welcoming society, and it's just really hard when you come to somebody and say, "Oh, we got a social distance, sorry," and so people shouldn't take that personal. It's really the person trying to say, "I'm trying to help you and protect you and myself."
And I think those social norms are going to have to change. I mean, just like if we saw Italy, they come up and kiss each other on the cheeks. And, in the spread, it was so bad, and Italy had so much disease presence and so many deaths. They had to literally change the way they greeted each other. And I think we are here in the United States are going to have to do some of the same practices. You may not automatically walk up and shake everybody's hand. It may be something different. And I'm sure our young people will come up with many different things on how to greet each other.
I've seen the suggestion of the foot bump, but you got to be coordinated to do that. And then the elbow bump, but that, again, with the social distancing stuff. But we're hoping, I know that the virus, it really sets the timeline.
Right.
It's nobody else can set the timeline. It's the virus, so you have to follow that. And I know that one of the biggest questions, and I try to let you guys speak to this, but in North Carolina, how many cases have been reported of the coronavirus, COVID-19?
In North Carolina, we have 5,024 cases currently, and actually here within the county, we just received another case this morning and have 16 cases currently here within our county.
And roughly, most health departments started tracking these cases starting about 2 months ago?
March 3rd is basically when North Carolina first
starting
got
date,
the
okay.
starting date, and so we have all kind of ramped up. That week it really ramped up, and we all got started to really tracking and really having it on our radar and really kind of looking at sick individuals and what needed to be done, and the state really got their task force together, and so that's when things really got started.
Okay. And so the starting date, the numbers, of course, you know, persons asked in Rockingham County, we have had some persons pass away.
Yes, we have had 2 deaths. Both of those patients had underlying illness, which causes you to have a worse disease process, or the virus to, you know, be a lot worse than if you were 21 years old and never had any underlying issues.
Okay. And so and then U.S.-wide, I think in we do a briefing every morning. The county manager puts together with all the heads, department heads, and also the health department representation and human services, and they talk about national and then bring it down to local and state. In the national level, you remember how many cases that we've had reported across America?
It's been 579,005 cases as of this morning. So that is a lot of cases across, and I think 1/3 of those are in New York, and of course the big metropolitan areas have been hit the hardest because of the geographic locations and the close proximity of people in those areas.
In New York City alone, you've got millions of people.
Oh yes, in a small area.
Okay, so and roughly how many persons, because of attributed to the coronavirus, how many people have passed away so far in the United States that we know of?
Not sure.
That have been attributed to. I mean, if you don't have it, I understand.
I don't have that. I don't think I have that data here. I had it this morning at our meeting.
But New York State, specifically around the New York City area and part of New Jersey, that cluster right there.
That area has the highest death rate in the United States.
Okay. Now, over the past few weeks, let's bring it back to the state level. The governor has brought in the National Guard to help for logistic support.
Yes.
And I think other governors have done that across the country to bring logistic support to provide setting up medical tents, the triage tents, and assisting with the medical side of this.
Yes.
Also, at the national level, the president brought in 2 ships.
Yes.
And now one of the ships went, and I can't remember the names. The ships, I'm remiss.
Mercy was one.
Mercy's one.
Mm-hmm.
Yeah, and is it in the Port of New York?
I think it's outside of one's outside of California.
And then one's in New York.
Yes.
Okay. Conference in New York, and you know we want. And first of all, I'd just like and to you and your staff and all of our medical staff across the country, thank you for what you're doing to help save lives. And also, I want to thank everybody for listening to the recommendations of our local health director and others about the social distancing, protective wear, and gear here. And if you feel sick, there's some recommendations. What are those recommendations? Say, for example, you feel like you've got flu symptoms or you're sneezing, coughing. Because you know we're into pollen season too.
Oh, absolutely.
So when people say when I sneeze or something, because this pollen's bad on me, I say, I got allergies, but.
If you feel sick, the safest thing to do is stay at home. If you have a fever that's greater than 100, you need to call your primary care provider or your physician, and they will let you know what to do. The recommendations is currently, if you just have mild symptoms, just to stay at home. Stay out of the public, stay at home, isolate yourself, treat yourself with over-the-counter medications for your fever, Tylenol. If you have a cough, you can take Mucinex cough syrups to help with the symptoms and alleviate the symptoms, but just that is real important to stay isolated. Also to stay isolated in your house. If you have a bedroom and a bathroom that you can use only for you, that would be the best case scenario, and a lot of people do not have that, but do a lot of good surface cleaning, clean your surfaces, clean your counters, clean your bathrooms, showers. You know, you want to be really doing thorough cleaning after you take a shower, and do that, you know, quite frequently, and have the person to stay away. If you have family members, children, try to stay away from those family members and have them in another part of the house if possible.
Well, we want to thank you for those recommendations. We're going to take a break for about a minute.
Okay.
And we want to thank you for those recommendations. Ladies and gentlemen, there's a lot of things you can do to keep things clean, try to keep it germ-free, and also protect one another. We'll come back in a little bit with Susan Young with the Rockingham County Health Department.
Okay.
This is Sheriff Spotlight with the Rockingham County Sheriff's Office, highlighting the office and deputies dedicated to providing law enforcement services and maintaining the trust and support of Rockingham County citizens, all while keeping neighborhoods and communities safe.
Ladies and gentlemen, if you're interested in a career in law enforcement at the Rockingham County Sheriff's Office, you can inquire at 336-634-3232. We're looking for the best here in Rockingham County, North Carolina, and we want you. Well, thank you. I'm glad to be back. I'm Sheriff Sam Page, and I'm with our special guest this month for April is Susan Young. She's the acting director of the Rockingham County Health Department. Susan, thank you for being here. I know you're probably the most sought-after person to talk to, have been for the past couple of months with the coronavirus conversation. You said the other day that when you're on TV, let's talk about being the face of the coronavirus. That may not be. That was my
daughter's statement.
Yeah, that's what. Yeah, I remember you saying that. But again, we welcome you here. We thank you and all your staff that are working here in Rockingham County to help keep us safe and give us great guidance. And like I said, if you're interested in getting information about the coronavirus, what's going on, you can go to the Rockingham County website.
Yes.
And y'all probably got several listings that you can click to.
Absolutely. We have a whole list of information there about things for businesses, things for the public, and things to do when you're sick, who to contact. So there is a wealth of information on our website.
If you have any questions about the governor's current executive orders, you can just go to the website and click it, and you can read through there and see what the restrictions are at this point. They could be lessons down the. I'm hearing a lot of governors talking about possibly lessening the restrictions, but right now, if you have questions about what the governor's position is, just go to the website and you can pull that up. If you had a concern about a medical concern, there's a number you can call that if you want to get some information on medical concerns dealing with the coronavirus.
Right, that is 211, and that is a good resource for any generalized questions, but also if you have medical questions, they will refer you to other resources. So it's just kind of like a catch-all to point you in the right direction if they cannot answer your questions. And they will get you where you need to be to get the information.
And that's a statewide number?
Yes.
Okay, now there's another number if you have a mental health concern or question, and that number is?
It's *275, and I think Cardinal Innovations has gotten that started for mental health questions because, of course, this is a stressful time, and of course that makes your workload increase. It also, we have staff that are testing people working on the front lines, and that always increases everybody's stress level during this type of situation.
Yeah, and I've been out in the field on and off for the past couple of months just kind of observing, and I've interacted with the public, and the toughest thing is when you have to tell somebody, hold up, you got to keep a little distance, and then I always come up and say, look, my apology, but it's for your protection and mine to protect us both here. And it's a little awkward, and the public is starting to adjust to that.
Yes.
But again, like I said, we ask everybody, please, work with these recommendations because they are making a difference. Hopefully we're seeing our numbers hit
plateauing. Yes, they are plateauing currently, and we kind of looked at that this morning. We had been climbing, and now we're kind of leveling off, and this is not a time to slack off with what we have been doing, the social distancing, the staying at home, keeping your gatherings, to just your family members. And I know this is extremely hard for teenagers. I have 2 daughters that are in their 20s, and this is, I think, has been very difficult for them during this time to also, don't gather with friends. Stay at home. Don't have cookouts. Don't just go hang out at each other's houses. It's very important to just stay at home for just a little while. We're all suffering through this together, and we will get through it together. And if we can just all hang on, there will be better times hopefully for the summer.
Now you've heard it from our health director, and listen to what she says. Make sure you keep your hands clean.
Yes.
Away from your mouth, your nose, your eyes. Make sure you wear protective gear. Now I'm hearing more recommendations to wear a mask when you're out in public or when you're going to be around others. Keep your social distancing of at least 6 foot.
6 feet.
Or better. You can do better. But the thing about it is those are some recommendations and stuff like this. But I'm going to go ahead now. I'm going to kind of migrate a little bit to some of the questions and stuff that have been submitted. And I'll start with basically, and this is all short version, because I know we have limited time, But basically, what is the coronavirus disease, COVID-19? Basically, what is it and where did it come from?
Well, actually, all coronaviruses are just our common cold viruses. And what makes this common cold virus so special is it started back in the Wuhan province of China. What has happened is it seemed to be isolated in bats, and then it seemed to transfer over to a human person, and it became very infectious at that point because none of us have immunity to it. It's just like if you remember H1N1, when that first began, it was a new strand, and this is also new, and none of us have that immunity built up already to it. So that's what makes it so dangerous and so easily spread.
Okay. Just what I see on TV, it looks like some of these countries now seem to be seeing some plateaus also.
Yes.
But a lot of that is attributed to education and knowledge about what it is and how to protect yourself. That's my opinion.
Yes.
And you're seeing that?
Yes, I think everybody has seen enough things, and the media has really put information out there, and most of the time it's been good information and information that we needed about how to protect yourself, how to wear masks, how to be appropriate, how to social distance, and the people that needed to get information have gotten the information that we've needed. You know, we've also put a state of emergency in here locally that kind of reiterated some of the things that, we can do, and actually to have where law enforcement can be involved to actually enforce some of those things.
Yeah, there are some situations where, if a person is not at essential function and stuff like that, and like you said, you made some recommendations, but if a person is violating, it could be actually some punitive.
Right, and I think the things that we saw were mostly centered around some church services that continued after, we had put the bans in place for people not to gather. And then also, I think some restaurants had some issues in the beginning. And that was all just working out logistics and questions, because none of us have never done this before. Yeah. And we were all just trying to figure out what's the safest and best way to keep everybody protected. And that, of course, started from the federal level down to the state level, down to our local levels. And we are just all learning about this together and what is the best things to do. So stay tuned, and we will keep doing the best things that we know to do. And
some of these restrictions can change, because I know that not long after the governor put some things in place under his executive order, then they came back with a letter recently that said that it was acceptable for the drive-in churches, right, where people stay in their vehicles, whether the windows are up or down, as long as there's no more than 10 people outside the vehicle, which normally is the preacher and the choir and the support staff.
Right.
But apparently that seems to be working good in Rockingham County and other places. But again, so stay tuned to your local news. Stay tuned to your local news, and also you watch your local and your state news and your federal news, because things can change. And we're just trying to keep up, because we've never really, in my career, we've never seen this before.
No, and things are changing. We get recommendations from the state, and we have a once-a-week update, and by the next week, things are completely, sometimes totally different from what they told us. So they're learning about the virus and kind of the infectious period and the rates and different things. So we're learning as we go, and we will try to keep everybody with the best recommendations and the most up-to-date recommendations that we can.
I guess this, one of the questions, I saw three that's very similar, but can I get sick with COVID-19 if it's on food, like processed food or something like this? How does that work?
The quick and easy answer to that is it has not been proven to be carried on any foods. So once the food is cooked, it doesn't like high temperatures. So once that happens, you would have more of a chance if you have like fresh produce. But once again, you need to take that water and you can take soap and wash some of your produce with the soap and water to kill some of those germs.
Well, that's always, over the years I've heard, with sprays and stuff like this, it's always a good idea to wash off all your vegetables and stuff before you eat them anyway, to get anything off them that may just be residual from the field or something else during the process.
Absolutely, and that's more important now. And frozen food, it definitely does not like those extreme cold temperatures, so you're protected there.
Now, a lot of people say, well, and even I say the same thing, a lot of times it seems like the flu season drops off. Now, people still have the pollen allergies, but when it starts to get warmer, a lot of times it seems like the flu kind of drops off. Have any of the health professionals, yourself or anybody, talking about that, or is it more hoping that that's going to be the situation.
And we're hoping that's going to be the situation with this. And flu season usually ends around June for the same reasons. Viruses don't like temperatures above 86 degrees. And once you get those temperatures above 86 degrees, even if someone is sneezing that out or it's on a surface, that heat is going to make it go away a lot quicker than you would in like the holiday seasons where it's colder.
Okay. I'm just looking through some of the questions here. Of course, am I at risk for COVID-19 from a package or product shipped to my home?
Well, I think that's still up for debate. There is still some that it can live on surfaces such as cardboard for 48 hours, but there are some wonderful YouTube videos out there of people who are receiving packages, spraying the package, cutting it open with a box cutter, taking the stuff out, and if you just leave that package alone in the sunlight, that will go away in 48 hours. You don't have to throw it away immediately. If you could just leave it somewhere outside your house in a garage and let those boxes just stay there, anything that is on it will go away. And then if you of course take the inside out, whatever you're getting, if you have to use it immediately, once you take it out, wash your hands of course, and then you can wipe down the surface of that item if you can do that, and then just wash your hands again. Just be sure to do good hand washing after opening packages and after kind of you're cleaning your items, and then wash your hands again. And
you could apply that to clothes too. I tell our deputies that when you finish your shift, hang your clothes outside, air them out, let them have sun exposure, and then wash them separately. And that should help too. I guess the same principle.
Absolutely, yes. That is what we're doing with some of our, we have kind of a shortage on isolation gowns at that point, and we have a thing sitting outside that we are, if we have Lysol, we're spraying the outside with Lysol and letting that heat and air kind of get rid of anything that's on that so we can reuse those.
All right, let me ask you this. When you are, I know that the executive order allows a person that looks after. My mother's a senior, and I look after her, call her every day. And I ask that when we contact persons that are susceptible, that based on age or medical condition, is be real cautious when you have to come around those persons. Recommendations, back to it again.
Wear a mask, wash your hands frequently, and don't, even if you want to, don't be huggy, kissy, keep that social distance.
Be careful with your exposure.
Yes.
Exposure to them.
Yes.
And at the end of the day, it's about keeping them safe and keeping you safe, and that's a good thing.
Right, and the other thing is people can be now what we call asymptomatic, which I could be asymptomatic, I could be walking around, I could still be positive, and what the mask does, if I'm wearing the mask, even though I feel fine, I could still give that to you, but the mask is going to protect both of me and you, me from giving it to you when I feel fine and don't even know I have it.
Okay, let me ask you this question because we got just a few minutes left. If someone needs to come over to the governmental center, at the courthouse we've got signage out. We've incorporated some different procedures for social distance and protection for the public and our employees. But at the governmental center, dealing with health department issues, if you have a health department concern or a social service concern, can you still get service?
Yes, you can still get services. You will be stopped at a tent. You will be asked some questions, and then you will be instructed what to do. Most people are going and sitting in their vehicles, and then the nurse or a person is coming and getting you out of your vehicle and escorting you into the building to just kind of decrease anybody waiting anywhere.
Okay, so there is a procedure, but when you get over to the governmental center, if you're going to the health department or you're going to DSS over there, go to the stop sign. The persons at the tent will come up, they'll approach you, and they'll basically sign you in and try to help facilitate you to get in and get the services you need. So the Rockingham County government is still operating. Rockingham County law enforcement and our local law enforcement agencies, we're still operating. It's just we're operating even more safer than we had to do in the past. But we're still providing that service. Once you know we're out here protecting and serving you, and that goes all the way to the health department, because they help a lot and protect a lot of people. Susan, I know we're getting a little bit short here. I first of all want to thank you and all your staff at the health department. I want to thank all the representatives from county government. We meet every morning. I get to see all the department heads, and we all interact to have that communication. What's been going on? What are we seeing? What's going on? The current issues. But if you'll pass on to your staff on your side of the house, thank you for what they do for not only for us here at the Sheriff's Office, but also for the citizens across Rockingham County. It's all about protecting lives and have quality of life.
Yes.
Is there anything else you'd like to say before we finish out?
I'll just say one question that kind of hit close to home. It was a question about, can you donate blood? There is a desperate need for blood currently, but what you need to do is you need to contact your Red Cross office. They're not having blood drives and blood is short. So what you can do is actually make an appointment, go actually to a blood center. You will be instructed where to go and what to do and how to do that safely. But that still is a great need all over the country and in our state.
Well, we appreciate it, and like I said, you can still donate blood. Check with the American Red Cross. Thank you, and thank the health department. Thank you for what you're doing with your time with us, and we appreciate you being on our show today. Ladies and gentlemen, thank you very much, and we will look forward to next month when we come up on June for the Sheriff Spotlight.